Stomach cancer, also known as gastric cancer, affects thousands of people around the world each year. While it can be a daunting diagnosis, modern medicine has developed a variety of treatment options that offer hope for patients at different stages of this disease. In today's video, we will explore the different ways stomach cancer can be treated, from surgery and chemotherapy to targeted therapy and immunotherapy. We'll also discuss what patients can expect during their recovery and how lifestyle changes can support treatment success. So let's dive in and learn more about stomach cancer treatment. Stomach disease, or gastric malignant growth, starts in the cells coating the stomach. It can foster gradually over the long haul, frequently beginning as pre-carcinogenic changes in the mucosal layer of the stomach. These progressions can slip by everyone's notice for a long time, and when side effects show up, the disease might have progressed. This makes early identification a test. Stomach disease can be classified into various sorts in light of where it structures. The most widely recognized type is adenocarcinoma, which starts in the glandular cells of the stomach lining. Other more uncommon sorts incorporate gastrointestinal stromal growths, significance, neuroendocrine cancers, and lymphomas. Every one of these malignant growths might require a marginally unique way to deal with treatment. Surgery for stomach cancer. For some patients, medical procedure is the first and most significant stage in treating stomach disease, particularly assuming it is identified in its beginning phases. Medical procedure plans to eliminate the growth and encompassing tissue, keeping the disease from spreading. There are a few kinds of medical procedure utilized, contingent upon the area and size of the growth, as well as the phase of the disease. One of the most well-known medical procedures is known as a subtotal gastrectomy, where a part of the stomach is taken out. This is in many cases done when the malignant growth is situated in the lower part of the stomach. Then again, an all-out gastrectomy is a greater strategy that includes eliminating the whole stomach, frequently when the malignant growth has spread all the more generally. For this situation, the throat is associated straightforwardly to the small digestive system to permit food to keep going through the stomach-related framework. One more significant part of a medical procedure for stomach disease is lymph hub analyzation. This includes eliminating close-by lymph hubs to check assuming that the disease has spread to these areas. Eliminating the impacted hubs can assist with forestalling further malignant growth spread and further develop endurance rates. Chemotherapy. Chemotherapy is one more key part of stomach malignant growth treatment. It utilizes medications to kill disease cells, and it very well may be controlled in various ways, relying upon the patient's condition. At times, chemotherapy is utilized before a medical procedure, known as neoadjuvant chemotherapy, to shrivel the cancer and make a medical procedure more successful. This works on the possibilities of a fruitful activity. After medical procedure, adjuvant chemotherapy might be utilized to kill any excess malignant growth cells and decrease the gamble of the disease returning. For patients with cutting-edge or metastatic stomach malignant growth, chemotherapy is utilized to assist with controlling the illness, diminish side effects, and work on personal satisfaction. This sort of treatment is called palliative chemotherapy. A few chemotherapy drugs are utilized in treating stomach malignant growth, including fluorouracil, otherwise called 5-FU, cisplatin, oxaliplatin, and capecitabine. These medications are many times given in blend to expand their adequacy. Notwithstanding, chemotherapy can likewise accompany secondary effects, like queasiness, exhaustion, and going bald, which can be made due with steady consideration. Radiation therapy. Radiation treatment utilizes high-energy beams to target and obliterate disease cells. This therapy can be especially useful related to chemotherapy, a blend known as gamma radiation. It is frequently utilized previously or after medical procedure to upgrade the viability of different therapies. In situations where medical procedure isn't a choice, radiation treatment might be utilized alone to assist with controlling the spread of the disease. The kind of radiation generally regularly utilized for stomach disease is called outer bar radiation. During this therapy, a machine conveys radiation from outside the body, zeroing in straightforwardly on the growth. The cycle is effortless, yet it can cause after-effects like queasiness, looseness of the bowels, or exhaustion. These impacts ordinarily die down after treatment is finished. Targeted therapy. Designated treatment is a more exact way to deal with treating stomach malignant growth. Not at all like chemotherapy, which influences all quickly separating cells. Designated treatments explicitly assault disease cells by zeroing in on proteins or qualities that are fundamental for their development. Two of the most widely recognized focuses in stomach disease treatment are the HER2 protein and VEGF, or vascular endothelial development factor. HER2-positive stomach tumors overproduce a protein that assists disease cells with developing. For patients with this sort of disease, a medication called trastuzumab, otherwise called Herceptin, is utilized to obstruct the HER2 protein and slow cancer development. Essentially, VEGF assists cancers with developing fresh blood vessels to supply supplements and oxygen, an interaction known as angiogenesis. Drugs like ramucirumab block VEGF, removing the cancer's blood supply and keeping it from the assets it necessitates to develop. Designated treatments are frequently joined with chemotherapy to build their viability, and they can offer less after-effects than customary medicines. Immunotherapy. Immunotherapy is one of the most up-to-date moves toward in stomach malignant growth therapy, and works by aiding the body's safe framework perceive and go after disease cells. It is chiefly utilized for patients with cutting-edge stomach disease, or those whose malignant growth is impervious to different medicines. One of the most widely recognized kinds of immunotherapy for stomach malignant growth includes drugs called PD-1 inhibitors. These medications, as pembrolizumab, block a protein on malignant growth cells called PD-1, which assists disease with dodging the safe framework. By impeding this protein, the resistant framework can perceive the malignant growth and assault it all the more successfully. Immunotherapy has shown promising outcomes in certain patients, especially those with growths that have specific hereditary qualities. For example, high microsatellite unsteadiness, MSIH, or confuse fix lack, DMMR. Be that as it may not be powerful for all patients, and clinical preliminaries keep on investigating better approaches to improve its advantages. Palliative care. In situations where stomach malignant growth has spread too far to possibly be relieved, palliative consideration assumes a pivotal part in working on personal satisfaction. The objective of palliative consideration is to ease side effects, like torment, sickness, and trouble eating, and to assist patients with keeping an agreeable way of life during their disease. Palliative consideration could include methodology to ease blockages in the stomach brought about by the growth, or meds to oversee torment and different side effects. Despite the fact that palliative consideration isn't healing, it can essentially affect a patient's solace and by and large prosperity during the later phases of disease. Lifestyle and recovery. Recuperating from stomach malignant growth treatment frequently requires way of life changes, especially when medical procedure is involved. For patients who have gone through a subtotal or complete gastrectomy, dietary patterns might have to essentially change. More modest, more continuous dinners are typically prescribed to try not to overpower the stomach-related framework. Patients may likewise have to take nutrient and mineral enhancements, as the stomach assumes a critical part in supplement retention, particularly for nutrients like B12, iron, and calcium. Working with a nutritionist or dietitian can assist patients with keeping up with their well-being during recuperation. Moreover, standard subsequent arrangements are vital for screen for indications of repeat and to deal with any drawn-out secondary effects from treatment. Clinical trials and future outlook. For certain patients, taking part in clinical preliminaries offers admittance to state-of-the-art treatments that are not yet broadly accessible. These preliminaries are fundamental for testing new medications, treatment blends, and creative methodologies like customized medication. Planning ahead, continuous exploration is working on how we might interpret stomach malignant growth. Propels in hereditary qualities, subatomic science, and immunotherapy keep on offering expect better treatment results and, at last, the chance of a fix. While stomach cancer remains a serious diagnosis, treatment options have evolved tremendously in recent years. From surgery and chemotherapy to cutting-edge targeted therapies and immunotherapy, there are many ways to fight this disease. If you or a loved one is facing stomach cancer, it's important to speak with a healthcare team to understand all available options. Thank you for watching, and remember to stay informed, stay hopeful, and take one step at a time on your journey to better health. If you found this video helpful, please like, subscribe, and share it with others who may benefit from this information. See you in the next video.